everybody. Welcome back to Psychedelics Today, a weekly podcast exploring the science and culture of the emerging psychedelic field with your hosts Kyle Buller and Joe Moore. Today on the show, we are joined by Dr. Elizabeth Nielson and Dr. Ingmar Gorman. You might remember Dr. Gorman from some of our previous episodes, but I'll give a little brief background about Dr. Nielson and Dr. Gorman. So, Dr. Elizabeth Nielson is a psychologist with a focus on developing psychedelic medicines as empirically supported treatments for PTSD, substance use problems, and mood disorders. Dr. Nielson is a therapist on the FDA-approved clinical trials of psilocybin-assisted treatment of alcohol use disorder, MDMA-assisted treatment for PTSD, and the psilocybin-assisted treatment for treatment-resistant depression, and is also one of the co-founders of Fluence, which I'll get into in a little bit as well. And Dr. Ingmar Gorman is a psychologist who specializes in assisting populations who have a relationship with psychedelics. He is the site co-principal investigator and therapist on phase 3 clinical trial studying MDMA Assisted Psychotherapy for post-traumatic stress disorder. After completing his NIH postdoctoral fellowship at New York University, Dr. Gorman stepped down as director of the Psychedelic Education and Continuing Care Program to focus on his efforts on Fluence and training future therapists. So this interview was really fun. Had a really great time chatting with Dr. Nielson and Dr. Gorman. Ended up doing this interview in person, which I really enjoy doing in-person interviews. It's always much different than just trying to chat with people on Zoom or Skype and remotely. So we chat about their new organization called Fluence. Fluence is a psychedelic education project, and they are offering different trainings independently and in collaboration with a variety of clinics, conferences, private practices, nonprofit organizations, retreat centers, and psychedelic research sponsors. So one of their main courses and education programs that they are hosting is called Psychedelics 101 and 102. And actually, I just learned that they will be hosting a workshop at the upcoming interdisciplinary conference on psychedelic research. So that's ICPR 2020. And that is happening in Haarlem, the Netherlands. And that is taking place in April. So their 2-day workshop is on April 21st and 22nd in the Netherlands. So if you're from Europe, or maybe you're from the States or elsewhere, but traveling to the Netherlands for this conference, definitely check it out. You can go to, ICPR2020.net and go up to program workshops, and you can check out their workshop information there. And yeah, this sounds like a really exciting conference. I think Joe will be making his way out to the conference. So if you're going, check it out. If you see Joe, say hi. I wish I could make it out there. Looks like a really awesome conference. So jealous that I won't be making it over there. Cool. So yeah, I hope you enjoy this interview. We kind of go over the board of what Fluence is, how they got started with it, and also some updates about the MDMA study with MAPS, and just kind of get into some nuances of integration and some things that they've seen along over the past few years, working in the clinical trials, and then also, training therapists with integration stuff. So definitely check out their website to learn more. That is fluence8.com. So that's FLUENCE, the number 8.com, fluence8.com. And yeah, I hope you enjoy this episode with Dr. Elizabeth Nielson and Dr. Gorman. All right, before we jump into the episode, just a little business. So this episode is brought to you by Audible. Audible is offering our listeners a free audiobook with a 30-day trial membership. Just go to audible.com/psychedelics today. It's again, audibletrial.com/psychedelics today, and start your membership. Get a free ebook. And cancel at any time too. wonderful way to support the show and also to learn. I've been loving digging into the audiobooks. I'm a huge fan of podcasts, obviously, and it's nice to switch things up and actually chew through a book that I really enjoy. A lot of great psychedelic titles up there right now. I guess psychedelically oriented. I think I just downloaded the William James Variety of Religious Experiences. So I'm excited to dig into that one pretty soon. And then one of the last books I just finished up was the Mescaline book, which Joe had the author of that book on recently. And this episode is also brought to you by Onnit. So if you want to save up, if you want to save 10% off your next Onnit purchase, you can use the coupon code SCITODAY at checkout. That's Onnit, ONNIT.com, and use the code SCITODAY at checkout. And that's only good for supplements, and some of their other stuff just doesn't work for their fitness gear. So sorry, can't get that 10% off for the fitness gear. But if you're interested in buying the supplements, their Shroom Tech or anything else, get 10% off. That's scitoday.com. And then also, in collaboration with Solterra, coming back and chatting with them and just going over my experience down there, decided to partner up a little bit and offer a discount code to listeners who might be interested in checking out retreats, if that's calling to you. You can check out solterra.co. That's soltara.co, and you can use the coupon code Psychedelics Today, and that will get you $200 off your next retreat that you book. So again, if that's calling to you, check that out. And just a reminder, if you love what we're doing here at Psychedelics Today, be sure to subscribe on iTunes, Stitcher, Spotify, leave a review. That helps us out tremendously, and we appreciate any feedback and reviews for that. And a really great way to support the show is just sharing a piece of content, whether that's on Instagram, reposting something on Facebook, sharing the podcast with a friend, texting it to them. It just helps to spread the word and spread the message of what we're doing here and helping to educate everybody about psychedelics, plant medicines, the therapy that's happening, and just the landscape here. And if you want to donate, patreon.com/psychedelics today. And yeah, you get some cool perks over there. I've been uploading some of the video from our Zoom recordings up there, early access. So yeah, definitely check that out. So again, thanks everybody for listening. And we really appreciate all your support. And I hope you enjoy this episode with Dr. Elizabeth Nielson and Dr. Ingmar Gorman from Fluence. All right, welcome back, everybody, to Psychedelics Today. Today, we are joined with Dr. Ingmar Gorman and Dr. Elizabeth Nielson from MAPS and then also Fluence. So welcome to the show. Excited to actually be here in person recording.
Great, thank you.
Thanks, Kyle.
So, Ingmar, would you introduce yourself? I know you've been on the show before, but just giving listeners who may not know you who you are.
Sure. It's great to be back. I think it was maybe about 2 years ago since I've been on the podcast. So I am a psychologist, and I wear several hats. One is as a co-principal investigator here at the MAPS private practice site in New York City on the Phase 3 MDMA Assisted Psychotherapy study for PTSD. And we are literally here. We are in...
It's a nice space.
Yeah, thank you. Thank you. I will leave your listeners to visualize what it might be like. So I'm a co-PI, I'm a therapist. I have the honor of being able to work with our participants and facilitate this process for them. I am also the co-founder of Fluence with Elizabeth Nielson, and we'll say a little bit more about Fluence in a little bit. I recently stepped down from the position of the director of the Psychedelic Education and Continuing Care Program at the Center for Optimal Living. I believe if listeners remember our last podcast, I was probably speaking from that role. Mm-hmm. And now have a very similar role with this company that we created called Fluence.
Awesome. Thank you.
Hi. So Elizabeth Nielson, I'm also a psychologist, and I also wear a couple of hats. I have I don't know, several jobs. It's a little hard to hard to put them all together. But I have a long history of working in clinical trials as a therapist on studies of psychedelic assisted treatment, FDA-approved studies for both mood disorders, addiction, and also the MAPS work for post-traumatic stress disorder. So I've been a therapist here at this site with Ingmar for around a year and a half, working on the MAPS phase 2 and 3 trials as a therapist. And I also was part of the Psychedelic Education and Continuing Care program at the Center for Optimal Living as the Director of Education and Training for about a year, and stepped down from that also at the same time as Ingmar in December in order to focus on consolidating the educational work that I was doing under the Fluence title and company, which is a little bit more organized for us, I think. Helps us keep everything together on one website.
Yeah.
So, yeah, I'm very excited to talk about that and other developments in the field. But I would just say from my perspective, one of my key interests really is therapist training, therapist education. In my work, I do a lot of supervision and training for therapists. And I think it's just really fascinating. I think there's a lot of interest, a lot of clinicians really curious about this work and about this field.
Totally.
And really coming from places of caring and concern for the people that they work with and looking to this as something that could potentially benefit the people that they care for.
Yeah. Awesome. Thank you. So I guess let's dig in. And so what's going on with the MDMA trials? I'm going to give some updates to listeners. I'm sure everybody's kind of curious what's going on.
Sure. So I think one of the most recent updates, maybe the most recent update, is the approval of expanded access by the FDA. That is for, I believe, 50 participants in total,
right,
across multiple sites across the country. And so that we're excited to for that to happen. It's been a long time waiting that. Our site here in New York, I do not believe that we will be doing expanded access. I think it was something that we really had the ambition to do early on. However, at the private practice site, the phase 3 trial really is requiring a lot of our attention. Mm-hmm. And one of the concerns, although this isn't specifically reason why we're not doing it, but one of the concerns of the FDA would be if sort of energy and resources were diverted from phase 3 to expanded access.
Right.
And right now, really just for us, from a resource perspective, we really need to be focusing on phase 3. I can say that we are very much near the end of MAP 1. So for listeners who may not know what that is, for the MAPS phase 3 trial, it was really split into 2 studies, MAP 1 and MAP 2. And what this signifies is that we are essentially close to the halfway point, or we're finishing MAP 1. So it's really one study that is near completion, but halfway point roughly for phase 3. I might add that MAPS and us as a site and as individuals, we're learning a lot. A participant actually recently reminded me of this, that this is a study. This is what study's for. You learn things while you're doing a study. I think there's an expectation that we know everything that we're doing and everything is set in stone. It's not the case. And so we are learning a lot, and my strong feeling is that when we transition into MAP 2, and begin that will be a smoother process for us for many reasons. One, foremost, just from an operations perspective, we're just continuing to refine how we're working.
Mm-hmm. And so between MAP 1 and MAP 2, are these different participants? So it's chunked off into 2 type of studies? And
that is correct. They're similar studies. I can't really say more than that.
Right. Yeah. Cool. And for the phase 3, do you have a little bit more flexibility? Because I know phase 2 is usually a little bit more safety data. Do you have Or what's the difference between the phase 2 and phase 3 for people that don't know what that means?
Yeah, I can answer that. So in general, the way that these studies are titled and designed, phase 1 would be preclinical data, so sort of basic data about chemistry and of the chemistry of a drug and how it metabolizes and those sorts of things, and things like figuring out if it's actually poisonous or not. And then phase 2 is usually where you begin to test your treatment in a patient population. So those are usually small pilot studies. They may include participants that are people going through the study to sort of test the feasibility, and for training cases for therapists to have that supervised experience. And then phase 3 in this case is these are where you get your data to demonstrate that this is a treatment that's potentially superior to placebo or to other treatments that are out there. In general, in a lot of drug development, phase 3 is done as a double-blind controlled trial, which means that both the participants and the therapists or people administering the treatment don't know whether or not the participant is getting a placebo or the active medication, but that's not necessarily the case. There are some other possibilities for designs. Yeah. And that's just general about what the phases mean in terms of drug development.
Right. Awesome. Thanks.
I don't think I'd like to spend too much time on the difference between phase 2 and phase 3, but just to comment on something that you've said, it's not necessarily the case that phase 3 is more open than phase 2. And to just give an example, for phase 3, my understanding is that it's required that you have GMP. That means good manufacturing practices for a drug. So it essentially has to kind of be at a state in which it would be ready to be delivered to the public, so encapsulated in a certain way, a certain purity. And so that is actually a really big barrier for people who want to do phase 3 studies, because it's extremely expensive. So that's just one little example of how phase 3 is actually a little bit more difficult than phase 2.
Gotcha. And what are, you said you have been learning a lot along the way. What are some of the big kind of takeaways that you've been learning?
Well, I mean, some of that will be boring to our listeners because there are really things around site operation. So how do we communicate as a team? Well, maybe actually they wouldn't be so boring, particularly for those listeners who think that they would like to start a clinic. I'm sure there's a number of people they're therapists who want to do this work. And I think that there's going to be a really big learning curve for people to figure out how to get their site operating in a way to be able to provide this treatment. And so there's a lot of collaborating between the people who, say, do a phone screen and the people who do an intake, and then the site physician. And there's just a lot of information that has to be shared effectively. And when that's not happening, or even collaborating with outside providers can be a significant challenge at times. So we're kind of continuing to refine just those kind of procedures. I think another part of this, and this is more personal for me, has been trying to get a sense of for whom this participating in a study would be suitable. So I'm trying to think about how to formulate this. Of course, I have to give the caveat that MDMA is not a medicine. It's something that we're studying. We hope that it has potential. But I think that in sort of not completely intuitive ways, and this maybe relates to more of the psychedelic integration, things can be brought up in the treatment that isn't usually on the radar of clinicians. And so just having an eye and trying to anticipate what kind of changes this treatment can bring in a person's life. And essentially, if a person is in a safe and, I don't mean physically safe, but just sort of in a place in their life where they're able to encounter those changes. Does that make sense?
Yeah, I think the added part of the piece is that the participants that we're seeing for this treatment in the study are also in the study. And that's a whole other role for them and a whole other set of responsibilities and things to think about and level of involvement that we, have in their lives from the study perspective, which is sort of in addition to the clinical treatment perspective. And so we meld those things together and it's kind of one package. And that's how we're operating right now. But we are thinking about a whole extra layer of things than we would be thinking about if we were just doing this, in a private practice setting.
Right.
And of course, that's not an option right now, but
hopefully soon. Yeah, one day.
Potentially, yes. Right.
Yeah. And I'm guessing even wondering too, like what have you learned sitting with people? Like, has that changed? Like, you're coming in here, you went through the MAPS training, you have an idea of what therapy looks like sitting for somebody that's on MDMA, and has that changed for you at all of like how to maybe approach this, or, have seen any challenges of like, whoa, this, I was not expecting that, or now I need to kind of like maybe tailor this a little bit more?
Well, I can make two general comments, which is one that I think that just having seen people through this process a few times, I think that my trust in our training and the approaches that we've been taught and the process of allowing people to take the lead for themselves through their sessions and trusting that what they find in there is relevant and important to their own healing has only deepened and grown. Mm-hmm. I'm always incredibly thankful for our training when we work with people, because we just had amazing training experiences and leadership in not just teaching us sort of what to do on a practical level, but really in empowering us to bring this treatment to participants. And I've also learned a lot in general about post-traumatic stress disorder, how it works, how it functions, how it manifests differently in different people, but also what are the sort of hallmarks of it and commonalities of it. It was something that I had less experience with before the study than obviously than I do now, but I've really learned quite a lot about that, and I found that quite moving. It's a population that I hadn't initially thought of myself as someone that was naturally drawn towards working with, but have really discovered quite a level of compassion for this particular form of suffering that has deepened and grown through this work.
Yeah.
All sorts of kind of clinical nuggets of gold have come to mind, and it being a podcast and respecting a participant's confidentiality. Even if I didn't identify them, I just don't want to. There are things I would love to share that have come up in session that I just, out of respect, won't talk about. Yeah. Maybe one day I'll get permission, and we will. But to add one thing to what Elizabeth has said is the multiple ways that post-traumatic stress disorder can manifest, what it can look like, and likewise the many different ways what we presume to be the MDMA experiences, because we are blinded, but the many ways that can look, and there are commonalities. Mm-hmm. One commonality that does seem to come up is the capacity that has been talked about many times, kind of newfound capacity to touch, return to a memory or an experience that was just so emotionally overwhelming that it was almost not inaccessible, but when one would become overwhelmed when a person went there, and this capacity through the treatment to be able to go to those places. I mean, that seems to be a continual theme. Mm. But then what a person does when they're there, or what they feel when they're there, the deepening or broadening, the way that they communicate, it is very interesting. Some people may due to their profession, may have or their education, a more kind of verbal way of communicating their experience, whereas other people may drop more on kind of more an embodied experience. So that it's really interesting to see how what they appear like and what they say in these experiences. Yeah.
Yeah. Ingmar, I know that you have had an interest in psychedelics like before you, started working on this. And I'm wondering too, like, being traditionally trained in psychology, like has working with MDMA like changed the way that you approach, I guess, psychology and the way that you practice? Like, have you had to change things on how to show up for people from like the traditional standpoint of getting trained? I'm just thinking this question in general with like, you guys are educating clinicians and therapists as well. And one thing that we got during our course was somebody said like, wow, like, this is really kind of, some of these transpersonal theories is really just challenging my traditional training, right? And so I'm wondering if that's been anything that you guys experience coming in, maybe traditionally trained. And
Yeah, so I would like to I'll answer you, and I think I know Elizabeth has a great answer to this to this question. Yeah. Well, if you don't say it, then I will remind you, and you'll know what it is. Okay. but just from a personal perspective, I think there's so much there, and this is my favorite topic, and we could spend multiple hours talking about it. But the 1 minute answer, the highlight for me was, well, first, it's hard for me to say that I was ever totally traditionally educated, because like I always knew that I kind of wanted to do this, and I was always sort of like following it. So it's always been infused in there. But one is the belief in the inner healing intelligence, or sometimes using the phrase just a person's intuition. I remember first learning about the inner healer and thinking like, oh, that sounds so hokey, and but it has affected my work so much, not just in the trial, but absolutely in even my private practice. Like one of the first things I do after I start a session with a new client or patient, I'll say, look, this is something that I really believe in, that there's a voice or some part of you that actually knows the way to move forward in your healing process. And my role as a therapist is to kind of support you in that, to identify what that is. I am an expert in some ways, but I'm not an expert in your experience. And so everything that I'm going to do is to try to serve that process, that mechanism. And so I have been profoundly affected and totally infused everything I do with that idea.
Yeah, thank you.
Apparently I have an answer that I might not have thought of. So if this isn't the answer that I'm thinking of, then Ingmar will have known what I'm actually thinking of. It feels like what I wanted to learn and know and practice when I set out to study psychology at 18, starting an undergraduate degree, but I didn't really know that until I found it. I didn't see something that ever clicked for me or made this much sense to me until I was invited to be part of a psychedelic assisted therapy trial. And that was initially 6 years ago. And when I saw what was being put together there, it was just complete. It was like a no-brainer for me. Yeah. So I never had any hesitation about it. And I think that pretty much since then, 95% of the private practice work or other therapeutic work that I've done has been either in the trials or with people who were seeking support around psychedelic experiences in private practice. So it's very much influenced that work. Yeah. What was I going to say?
Yeah, I'm curious.
So that is your experience, which is what the question was. I was wondering if you could maybe touch upon a little bit about the topic of unlearning for clinicians. That's something. Should I talk about that? The topic of unlearning. Yeah. So for people who have a traditional background, approaching learning. Yeah.
Okay. Now I know what you mean. This work really requires us to trust people and trust people's minds and trust the value of this experience in a very, very profound way. And to be able to follow their experience, we have a saying that comes from the MDMA training that says, they say, don't get ahead of the medicine, don't get ahead of the MDMA. But that's not just for the patient, it's for us as well, to not get ahead of their process, to not think that we know the answer, but more to focus on allowing the participant space to find their own meaning and find their own way with that. And I think that a lot of what we learn and a lot of what therapists are traditionally trained to do is like conceptualize, lay out a map of like, this is what's going on for this person, this is how it works, this is why they're in distress, and then the therapist kind of sits there with this idea, like, I know what you need to work out and where needs to lead. And you just, we'll eventually figure that out if I sort of like guide you. But we have to really allow that, not know that in a very profound way. And that requires some unlearning as far as not doing what we're traditionally taught to do in school, which is to conceptualize things in a certain way and then sort of help guide that person through a series of interventions to make the change that is sort of laid out for them, either internally, cognitively, emotionally, or behaviorally, or whatever we're working with.
Yeah. I can just add a little bit to this, which is that there's a really interesting paradox and tension that exists between unknowing and following their intuition and having a framework for what you're doing. So, just to bring in a personal anecdote, I don't know if this is something that's discussed in the more mainstream literature, but sometimes I joke around with a mentor of mine about my psychotherapy superego. So in other words, as a therapist, when I'm sitting there, this is more so when I was in training. Or let's just say it's quieted down a little bit over the last year or two. but particularly when I was learning how to do psychotherapy and different kind of approaches, there's this voice in the head that's saying like, okay, are you doing this right? Are you doing it according to this orientation, this method? Are you being too directive, not directive, not? And it's just kind of, maybe not critiquing, but kind of analyzing, and there's something incredibly, and this maybe reflects a little bit of a relational approach, but just sort of to give myself permission to not stray too far afield, but to be creative and spontaneous and open to my own intuition and listening to that process for somebody else. Yeah. The tension between that may exist is that, this is something that I think I've heard Jeff Gus talk about this, or maybe it was through Elizabeth and Jeff mentioning this, that I think it would be potentially risky for somebody to entirely trust the inner healing intelligence and intuition with, let's say, with a patient who has a lot going on, who's suffering very, very severely, and sort of just say, you know what, I'm just going to be completely intuitive. I don't need any kind of reference point, and it's all good. And sometimes I see this reflected in some people. Like, you just trust the process. But it really is you need to trust the process. But I think you don't want to have a too detailed of a map that's too restrictive. Right. But you want to have a general kind of framework for how are you working with the person, and that paradox, I think, is something that we constantly kind of hold together.
Yeah, it's interesting. I mean, just even thinking about like all my experiences training with breath work, and that comes from Stan's kind of theories and whatnot, and just being so non-directive and really trusting that inner healer process, and then realizing like, when do I intervene, right? Because there are times where you kind of have to get in there, and then you're kind of fighting with this thing. It's like, oh, but trust the inner healer, but wait, there's also a safety thing going on there. But then on the flip side, I've heard this story. My teacher Lenny told me it, that one facilitator saw this guy curling up, and he's like, oh, he's going through the birth canal, having this theory, and he went in, swooped in, did some body work on him, and then during the group sharing, he's like, I was a Viking dying on the battlefield, and it's just totally different from like what we might be experiencing, right? And be like, And so it is. It does seem like you need to kind of tap into that intuition a little bit of being like, how do I let this, like, really trust that inner healer process, but also when do I need to intervene if there's something like mechanically wrong or there's some safety stuff coming up? Cool. So I guess on the topic of, was there anything else about MAPS updates or anything that you guys wanted to touch on? I feel like we're kind of moving into a little bit of the education realm. So Yeah. So do you want to give the listeners a little background about Fluence? Like where did the name come from and what are you guys doing with Fluence?
Well, if you want to know about where the name came from, that's Elizabeth. So I'll hand
I don't, it was 3 days after Horizons and I was stuck at home for a couple of days because I caught the cold that was going around. And I don't know, I talked to Ingmar that morning and I was like, we need a name for this project. And we just didn't have one that felt like a good fit. And I was just jotting down some word roots and kind of came up with this and then Googled it. But Fluence actually means a couple of things. It means it can mean a magical or mystical power or source of power, and it can also refer to, I think, the density of energy, of particles of energy. So it is a term that can be used either in industry or in physics or to refer to something, but it's not a very common word. It wasn't a word that I had ever heard before.
I didn't either, and I looked it up and I saw that like mystical definition, and I was like, oh, that's pretty cool.
Right. So it indicates flow, direction, power. It's and it's unique enough that we were able to use it. So,
yeah.
So my wife is she works in publishing, but does a lot of work around physical chemistry. And I said, "Do you know anything? What does this word mean?" And she says, "Oh, well, it's sort of synonymous with the word flux." And then I think, oh, well, flux capacitor, like that's like association. But I think it's like the particles travel. It's like dense. I don't know if it's density, but it's also like through space. It's like the passage of energy, I guess, over a given area. Yeah, well, that's okay. Well, it's very important, of course, for all of our listeners to know the exact definitions of Fluence. Yeah.
So an educational project.
Yes.
Yeah,
what
we
are
should
you guys
get to
doing
what is
with
it that it actually is.
So what we mean by Fluence is it refers to the educational project that we have started where we're really combining several activities that we had been doing sort of very independently and a little bit scattered about for the last 2 years or so. We developed a workshop that's an introductory training for clinicians, including all mental health care providers and anyone who sees patients or clients pretty much in any capacity that thinks that they would be a good candidate for this is welcome to come. It's a 2-day workshop where we cover a little bit about history of psychedelic assisted therapy research, a little bit about theories about integration, a little bit about harm reduction, and we teach about harm reduction informed preparation and integration in a way that's meant for clinicians to be able to begin to have conversations around those topics with people that they're seeing in private practice who may be considering having or who may have had experiences with psychedelics in other settings, such as ceremonial settings, religious ceremonies, retreat settings, peer settings, any other setting that they might be working in. So we're not actually teaching psychedelic assisted therapy protocols and procedures in those workshops, but coming from a harm reduction perspective, we think it's really important for clinicians to be just able to have those initial conversations and to incorporate that topic into the consulting conversation.
Super important. And you guys probably come from an interesting harm reduction background, coming from the Center for Optimal Living and that harm reduction approach.
Yeah, so we could talk a little bit about our influences. So one primary one is the integrative harm reduction psychotherapy developed by Andrew Tatarski. And each part of those, you may be wondering what's the integrative part, and that comes from a tradition of integrating psychotherapeutic methods. So rather than being overly adherent to a particular kind of school of thought, it kind of integrates them. So the word integrate comes up a lot in meaning different things. So integrating different schools, in this case, kind of a psychoanalytic or psychodynamic way of conceptualizing, like having that kind of framework for how people, kind of how they operate, I guess you could say, and but not being overly too adherent to that. being also open-minded. Integrative harm reduction psychotherapy also integrates cognitive behavioral therapy, so recognizing that behavior is also an important component of change. And then the third integrative piece is mindfulness. And that's something that is particularly important for us. And Elizabeth's background comes from a strong mindfulness-backed education. And it's really useful in psychedelic integration, and I would say even in psychedelic assisted psychotherapy. I don't want to speak on behalf of Elizabeth, but she could say more about that. And then another part, of course, is the psychedelic therapy, as we were taught by MAPS, Michael and Annie Mithofer, and Marcella and Bruce, and that whole lineage through Stan Groff. And then finally, the relational psychoanalytic school is particularly dear to my heart, also integrated in the IHRP model, but this kind of approach to the relationship using kind of a somewhat postmodern perspective that kind of there's a co-creation of this kind of a subjective experience when two people encounter each other, and understanding that one can't be an independent observer as a therapist, that we are in the relationship, we are influencing it. And I think that way of thinking can be really helpful in working with people who have psychedelic experiences, when sometimes sometimes in very, very, very dramatic ways, the question of what is real and what is not can come up. And so having that kind of background can be helpful in focusing on maybe the here and now and what's happening in a person's life. So I don't know if you want to say a little bit more about our influences? No? Okay. Well, the other thing I should say is my biggest influence is my clients and my patients. Like, I get inspired by them, and I'm very motivated to continue to provide more advanced training from Fluence. And I think a large sum of my insights and thoughts come from the situation that I'm in when I'm sitting there and listening and talking to them.
Yeah, I could add that a large piece of, or really our main motivation for creating this program, was sort of twofold. One, patients and clients coming to us that had experiences of looking for a clinician just with whom they could talk about their experience, and really running into some trouble there. Maybe some judgment, maybe just misunderstanding, maybe just lack of information on the clinician's part. But people who really wanted to be able to talk about this in therapy with their healthcare providers, their therapists, and were not able to be met with what they needed there, as well as clinicians reaching out to us saying, where do we learn about this? How can we want to be able to have a good conversation with our patients about this, and we don't know how to learn about it. So there was a creation to really try to bridge that gap and meet the demand on both of those parts. We certainly get calls from more people than we could ever see in our private practices, even if we were doing that full time. So by helping other clinicians to learn about it, we're hopeful that there will be more knowledge out there in the field.
Yeah.
So we were talking earlier before we started the podcast about some examples, and I'd like to do that to liven it up for our audience to get a sense of, now this is not necessarily an integration, meaning in the integration phase of treatment, but a good example of something that I've encountered in terms of people reaching out to mental health providers. So a person reached out to me, a mother whose teenage daughter, 16 or 17, I don't recall exactly how old at the moment, who had depression. And they were having a very, very difficult time treating the teenager's depression. And the teenager was in psychotherapy with a therapist. And eventually the family decided that it would be, with the daughter, that it would be a good idea to try ketamine intervention. And so the teenager, she has the ketamine treatment, and it's successful, and she is relieved from her depression for some period of time, long enough to go to therapy, to go back to her therapist and say, I went for ketamine treatment and it worked. And the therapist's response was to fire the daughter, like discontinue treatment with her, and call Child Protective Services on the mom for providing the ketamine treatment. So now I'm not advocating, and there's not for necessarily ketamine treatment for teenagers or children, although ketamine is used for children and not psychiatrically, but for other purposes. But just that the amount of kind of stigma and misinformation and the type of reactivity that clinician had to follow through with those actions, that's almost incomprehensible. I was shocked when I learned about it. And it was the mother who was reaching out to me saying, this is what happened. We're looking for a therapist who won't respond in that way when we find something that was helpful.
Right. Yeah.
So that's just kind of one example of what we hope to do with Fluence. Is there's a psychotherapy process element to like teaching how to do psychotherapy, but there's also an education piece that a person doesn't necessarily have to be a therapist. I mean, that could have been a GP, could have been anybody.
Right.
And just for them to sort of know, like, okay, this is what's out there. This is what's actually maybe around the corner in terms of novel treatments. And it's important that people know how to respond ethically and appropriately.
Totally. Yeah, it's so important. Wow. Thanks for sharing that story. I could see like, if they're doing that in the underground or something like that, but like kind of trying to do that when a psychiatrist or a medical professional was providing a service, it's kind of wild.
Another great thing about having a continuing education program that's, credentialed in such a way where people can get continuing education credits is that people can then kind of take that back to if they work for a clinic or even if they're in private practice, if they are ever challenged about, or, somebody ever says like, well, are you trained for this? There is a way that they can attend our program. They can have a continuing education certificate. They can put it on their CV and they can say, yes, do have some training in this. And I think that's really important because it lends a level of professionalism and legitimacy to this particular work. I mean, there are great training programs in, for instance, integrative harm reduction psychotherapy that somebody could attend and practice and document that they have some formal training or consultation group experience and supervision with. But this brings integration, psychedelic harm reduction integration into that level of a professional playing field.
I'd like to make a few points that I just wanted to get across, if that's okay. Yeah. One, we're talking about this pretty enthusiastically. Both Elizabeth and I feel really passionate about psychedelic integration. But one message I want to get across to all the listeners is that our position is not that everybody needs psychedelic integration psychotherapy, or needs to be in therapy to do psychedelic integration. I think that's not the case at all. I think what we are really trying to do in terms of helping people truly integrate their experiences is if they feel like that's something that they can't do on their own or in the support of their loved ones or community or family, that they can go to a professional if they're struggling that is equipped to support them and help them. And one other point that I really wanted to get across is that it's hard. I find it that it takes time to explain what psychedelic integration entails. And when I encounter people who ask me about it or who have an idea about it, it's often summarized as either two things. One, and maybe it's because we've promoted it this way for a while, maybe it's our own fault. But one is that, we try to reduce the harms, which is that people think, okay, a negative psychedelic experience, and now they have some residual issues that they need help with. Or they've had a really beneficial experience and they're wondering how can they sustain the benefit. Like there's this idea of like holding on to it, retaining it. And although that's definitely within the scope of what I do, what we do and what I do, but I find it to be so much more nuanced and complex. And one way this is what I truly encounter with people. And the thing I truly encounter with people is this idea, if psychedelics, if they are 10 years of psychotherapy in one night, and somebody at a class actually did a really great job of correcting me. She said, no, it's not 10 years of it's not 10 years of change in one night. It's 10 years of insight in one night. So if that's true, let's assume that is true, that it's 10 years of insight. That's a whole lot of insight in a small amount of time.
Yeah.
And what often people struggle with is how do they then, that insight alone can cause discomfort or distress or symptoms, often in ways that are not just anxiety and depression, but sometimes the stress can be so much that it kind of creeps up in odd physiological forms that I think gets a lot of diagnosticians confused about what's going on. And two, not just psychically, but also in a family relationship, in job settings in particular. I have a disproportionate number of people who come to me who have a psychedelic experience and then struggling with really big decisions. Yeah. Divorce, changing careers. That's not uncommon. It's actually common. It's common. Yeah. And so that is, and when you're in that territory, you're not talking so much about, self-dribbling basketball machine elves from but you're talking about more in the domain of like everyday psychotherapy.
Right. Well, it's what those things are telling you, right?
That's true. It's what the machine elves tell you. That's right. That's right.
Maybe the job isn't working for you. Oh God, now what?
Well, I guess maybe I should. I take that actual point seriously. It's not the interpretation of those things.
Right.
It's not the interpretations of the basketballs. It's maybe what the basketballs are telling you. Yeah. But our job as a therapist aren't to interpret what that is for the other person. We trust their healing intelligence, their intuition about what that might mean.
And I guess, how do you approach that? Somebody comes to you maybe looking at you as an expert, hoping that, you have training in psychedelic integration therapy, and I'm going to go to this person, maybe they'll tell me that, I should quit my job, or maybe I should do this. How do you sit with that and work with clients that are coming in, maybe looking for answers?
I mean, one of the things that we, I think, really start with is a lot of assessment and sort of taking stock of what like any decisional balance would be. We certainly understand that, people may come out of these experiences feeling that they want to live their life in a different way and can support people in making that change in a way that feels aligned for them and holistic to them and ultimately maybe more comfortable to them. But it's possible to sometimes do harm reduction around changes that would be someone might want to put into place after a session, just sort of figuring out how to navigate those things. And again, that's really psychotherapy. But because we have the background with the psychedelic assisted therapy and psychedelic integration, we're able to perhaps, look at that experience as a starting point, a learning point, a place of insight in a way that a therapist that didn't have that training may not really be able to understand and to incorporate. Yeah. Yeah.
And this may have implications for, I've been thinking about writing an article about this and I haven't done it.
So I have lots of articles half written.
Yeah, right.
I feel you.
This will be, so I'm putting the idea out there. One of my concerns about psychedelic assisted therapy, when it becomes available, has to do exactly with what we're talking about, in the sense that the predominant medical models that you remove the symptom and the person's doing better. And what seems to be happening with these treatments and these experiences generally is that people get sometimes greater insight into what is causing them their distress. And the thing that I'm worried about is, well, sometimes I encounter situations where a person has an understanding of the source of their distress, but due to systemic reasons or other reasons, relationship reasons, what have you, they there's a lot of risk. There's a lot of on the line if they are to make the change that they know that they want to make, but it may have. They may not be able to. Right. And then there's a kind of discomfort, distress. It's difficult to sit with that knowledge but the difficulty with the action. And maybe part of what integration therapy is also about kind of navigating that journey. And my concern is that with a kind of more mechanical medical model that if these treatments do become available more widely, that clinicians may not be equipped with that knowledge.
Right.
And so they'll think, okay, well, we're treating this disorder with this psychedelic. This is going to help you. You're going to feel better. And then people maybe have some of their symptoms resolved in some biological way that psychedelics do act. But they may find themselves sort of in the situation that I've described, and then they may have complaints that can even be somatic, like physiological or emotional. And then people are going to think, oh my gosh, like these drugs lead to all these different kinds of side effects. I think we need to have infrastructure and community support and other kinds of ways of helping and education around that to sort of anticipate that this might be something that happens.
Yeah, we get emails all the time about, things, maybe people feeling like a little worse at times. I've been following the research. I had this session and I think it is part of that integration, right? When you're just overwhelmed with too much insight and then there are these systemic issues that you can't necessarily change, and then you come back to it and you go, okay, now what? Right? And like sitting with that could cause more depression or anxiety. I know, even just not talking about psychedelics, but just even thinking about my near-death experience. I mean, coming back and being blown wide open and seeing how things work per se. I mean, that's how I felt. And knowing that I couldn't change anything and just going to school and just being like, I couldn't focus on anything. I was like, why am I here doing this stuff? None of this stuff makes sense. And trying to tell that to people within those institutions, it's like, oh no, like you have to be here. And I'm like, but I saw something way beyond what all this is, right? And I think that's kind of similar to psychedelics. You come back and go, whoa, okay, now I need to make some change, but I don't even know where to begin, right? And that insight or those experiences can be really overwhelming. And I think it's important to be honest about that as well as this field progresses and moves forward.
Absolutely. And the more, we feel that mental health practitioners can really be a great source of support there and in those situations, because one of the principles that we teach from is that people who are already great therapists and great clinicians have a lot of skills that are really applicable to this. It's not a whole different skill set. It's perhaps a slightly different way of thinking, or a new way of thinking about it, or a paradigm shift, if you want to call it. We like that term. It sounds good. But it's not foreign to somebody who's a good therapist,
right.
Who would otherwise be supporting somebody through a difficult experience. Sometimes therapists might be sort of distracted by the idea that it's a post-psychedelic situation. But when they're actually able to kind of wrap that into the larger picture and realize, what's going on and just how to support somebody through that, I think therapists are a great pool of people to be drawing on into this kind of work.
Totally.
Yeah.
A little image kind of pops in my head when you said like paradigm shift. It's like, oh, maybe the therapist isn't pathologizing you if they're talking machine elves during an experience, right?
Exactly.
Like, oh, okay.
So that would be the paradigm shift. Well, I mean, most therapists in our training, in our doctoral programs and master's programs, we're taught very little about psychedelics, and what we were taught was, to assess for problems afterward, to expect things that are really not what most people are seeing, and not to really investigate that as a potentially very valuable experience. So that's a shift in thinking for a lot of people.
Yeah.
But I think a lot of people are really open to it. I did want to add one thing about our trainings, which I think is also important to cover. Ingmar sort of started to name a few things, but one thing I think it's important to mention is that we don't actually give people psychedelics as part of training. We, first of all, our programs simply do not include that. So if anybody is wondering and thinking of joining us, please come join us, but we will not be actually providing any psychedelic experiences in those trainings. We recognize that for some people that can be considered a valuable training experience. MAPS has run a study in which MAPS therapists and MAPS therapists in training can participate and take MDMA as a study participant in another study that's run by senior MAPS trainers. So there's that for precedent. There's certainly precedent for that in the literature and research that was done in the 1950s and 60s and early 70s, but that's not part of our program. We do feel that experience with alternative states of consciousness is an important and valuable experience. And we do roll some non-drug alternative state of consciousness contemplative practices into our trainings, but they are definitely not any psychedelics in those trainings. So you're really clear.
Yeah, thanks for pointing that out.
No problem.
And then also, too, this is a question that we get sometimes. You're also not training psychedelic assisted therapists.
That is
right?
correct.
Only MAPS for right now can do that for their MDMA and Compass for psilocybin. We're just creating
that is correct. Yes.
Theories, framework, and understanding.
I would say that our training is very compatible with what's being taught and trained in those protocols and in those styles. It's certainly related and could be considered a nice intro or stepping stone or additional piece to have, but that is correct. It is not those particular protocol trainings.
Although one day we hope to be able to provide that.
Yeah. I guess any other challenges that you've seen with integration? And I know you said integration seems like this little nuanced thing, and I've obviously been thinking about this for a while. I sometimes differentiate between self-care and integration. Sometimes people are like, just do yoga. That's part of integration. I think about, okay, these are self-care practices, but what is integration? I feel like the community itself hasn't really defined what integration is. And I always kind of think about it as the process afterwards. How are you piecing all these pieces together, right? And yoga and meditation are incorporated in that, but I view it as the bigger picture at times.
So I'll give a metaphor.
Cool.
And this is the case. This has not come up by me. This came up by somebody who I worked with, and I told him that I'm going to use it. So he said that before his psychedelic experience, he was hanging on by a thread, and then after his psychedelic experience, and when he had it, he was able to see all of these different threads. And then what the integration for him was weaving all of those threads into a rope that he could then sort of pull himself up with or hold on to. And to me, that is a good visual representation of what integration is. It's making something whole and taking the just massive download that sometimes people can have and working that into something that can be even more useful to them. And it's not like those threads disappear if you don't turn it into a rope.
Right.
But it's somehow turning it into something that can be even more useful.
Mm-hmm. You have anything to add?
Yeah, I think that's a beautiful image. Thank you for sharing that. And there are several different ways to kind of conceptualize or think about it. That's certainly a great one. I sometimes think of it as living by the insights and values, or adapting to live one's life in a way that's more aligned with the insights and values that one discovers or finds very naturally. So there can be a sort of integrating of the parts of one's self that may have felt at odds with each other, or that may have been sort of in competition or struggling to make peace with each other, sort of competing demands that may feel more integrated and more whole during and after that integration process. Another way to think about it is moving from state to trait. So moving from the sort of state of having insight about, oneself and the nature of things, to living in a state where that insight is sort of present and available and a guiding source of information for people on a regular basis. And this is something that, there's research on this with meditators, where they'll look at how people move from being in that meditative state to actually having long-term changes in their traits and the way that they present on a regular basis. So we can kind of liken it to that.
And just to add, also that integration, because we tend to focus on the individual, that integration is not just within one person.
Right.
there's the level that we're talking about, but then there's also in, say, the family system, right? How much does a rapid shift for one person impact the relationships within the family? And so integration is about navigating that. And then many other people have spoken about this, about integration in the context of community. So that often insights don't just relate to how one can improve their own life, but also how do they as an individual relate to a larger group of people. And those are sometimes the most invigorating and exciting ideas, and also sometimes the most challenging ones to bring to the world, because it involves it's a heroic effort.
Yeah, and I always think that it's a process that continues to unfold too. I mean, it's interesting looking back at certain experiences and realizing years later, it's unfolded in a strange way. Like, I mean, psychedelics today has been such a huge integration process. Like, I got this download in a sense, like during my first breathwork experience about teaching and education. And then that 2 years or 3 years later after that, I ended up creating like a course at my college based around this stuff. And then it's just been, and it's like during that one experience, like, what am I going to do with all this? I had no idea. And it wasn't until like, I always kind of come back to that garden metaphor too, right? Like sowing seeds, planting them. And sometimes we don't see the fruit until like years later, right? So it's really a process to stick with as well. Yeah, anything else that you guys want to wrap on? I know we're hitting about an hour, and we could probably keep going about things, but anything that we didn't touch on that you want to...
Well, one thing is, we just 2 weeks ago had our training at Menla, which was just so amazing. I mean, I'm not going to go into it. I know Elizabeth is going to give me a lot of credit for not sharing the Mad Monk story, because I wanted to always share the Mad Monk story. But okay, save it for the training. But for those who are familiar with Robert Thurman and the Tibet House and Menla, we were able to do our training there as part of a 4-day training, which was just beautiful setting. It also allowed us to not have to we could really take our time with the teaching, the content, because we had yoga and meditation and different kinds of activities that it wasn't just sitting and listening for 8 hours. Suited it very, very well. And I think it was we keep getting, not to be self-congratulatory, but I do think that our trainings are getting better every single time. And
you learn along the way, right? So it's going to get better and better.
I don't know if you want to say anything else about the Menla training, but we should also maybe mention some of the upcoming trainings. Yeah?
I can do that. So in 2019, I think we had 5 of these 2-day workshop trainings for clinicians. They were all full. And it was hard. I mean, I felt the strain and the sadness of having to tell people we just don't have room for you. So we are expanding. In 2020, I think we will have probably 12 workshops. Wow. We will be in Europe. We will be in the United States. We will be in Canada, and probably East Coast, West Coast of the United States. So we're still working on setting up a few, but we just introduced a program in collaboration with Ingmar Gorman and Tiffany Frank of Ember Health, which, if listeners are not familiar, is a ketamine practice in Brooklyn that we've collaborated with pretty consistently for a while now. And so we've created a 2-day training that is specifically for people to learn about ketamine and ketamine preparation and integration in psychotherapy. We'll be holding 3 of those in May, August, and November, also in Brooklyn in collaboration with Alma, which is like a shared community style practice where therapists can come in and basically have their own private practice, but in this shared practice space. Cool. It's incredibly intentionally designed, and they've just done a beautiful job with it. So we're going to be collaborating with them for that. We're going to be holding several more versions of our 2-day Psychedelics 101 and 102 workshop. We're looking towards doing another retreat style version or 2 before the end of the year, but most of them will be 2-day non-residential formats. Cool. The next one we've got coming up is actually in Toronto the first weekend of April in collaboration with remedy, which is the practice of Dr. Ann Wagner, who's also a MAPS researcher.
Awesome.
So,
Exciting.
yeah.
I just before we wrap up, I really want to say one thing about the ketamine trainings that we do, because I feel this is very important for me, and I want for people to know that if you're interested in ketamine assisted psychotherapy, we don't really spend too much time on that, and there are other trainings available to learn about it. And I really want to distinguish what we're doing from that. One of the primary motivations for our primary motivation for the training for Elizabeth and I was this recognition that there are many ketamine infusion clinics that are available, and there are more popping up, but that there is often a neglect of the subjective experience, which can be profoundly psychedelic. And just to say that I've worked with people who've had the same dose 6 or 7 times, standard 0.5 milligrams per kilogram infusion, and on their sixth or seventh experience have a full-blown ego death experience. So I don't know why that is, but it happens. So this notion that these doses aren't, they tend not to be like that, but it happens. And the fact that there is no support for people who are having these experiences in often very sterile settings, there's no integration.
Yeah.
And so the purpose of this workshop that we do is to educate both therapists and doctors, whether they're anesthesiologists or psychiatrists or emergency doctors or nurses, what have you, just to sort of educate a little bit about what goes into preparation, what goes into integration. And finally, if ketamine facilitates neuroplasticity and there's a neuroplastic window, you would think that it's going to be important to engage in psychotherapy during that time.
Totally.
To take advantage of new ways of thinking and new ways of being and acting. And so let's and there's some research that is published that supports better effects with psychotherapy after an infusion, not ketamine-assisted psychotherapy, just an infusion. And so we want to spread that message, and we want to help people to just increase the quality of care that's being provided. That's my little soapbox.
Awesome. Well, thanks so much for all the work that you guys do. The education piece is just so important. I think as we move forward, and I think there's, as more stuff gets out there, I mean, there's just so much need for education, and especially on the clinical side of things. I remember, when I was younger, just trying to show up to a therapist and just the shame that came with that of like disclosing and being like, oh, I guess I did something bad, But yeah, it's much needed. And so, where can people find you? What's the website?
So our website is Fluence8, the number 8, digit 8.com, Fluence 8.com. You can find us there. And within the next year, we're also looking to add some online education modules. Cool. So there will be sort of an online version of our course with some teaching assistant availability, and we're actually in developing that right now. So we've gotten a lot of requests, especially from people for whom traveling to a workshop would be not feasible. We want to make this, at least the basic course, really accessible. So there's going to be a lot of new developments there, and there is a mailing list sign up on that website, which would help us to get in touch with people who are interested. We also maintain a Google group for people who have taken our trainings, and that is growing rapidly, and it's a lot of fun. So cool. People who have come through a workshop are then able to connect with each other and connect with other people who have taken it and find referrals and ask for information. And so we really kind of, again, create that community. And it's really fun and interesting to see people who have taken the workshop, even just within the last year, starting to bring this into their practice and, interact with patients around this and, maybe start a group or be working on a writing project. So we're seeing a lot of the people that we've trained already grow and become really important in this work. Yeah. I think it's up to about 380 now. Wow. It'll be, every time we do a training, it bumps up by 50 or 60 people. Mm-hmm. So, and we're getting very professional audiences, which is a lot of fun.
Oh, I guess that's a question. Is it just for licensed therapists and clinicians, or can graduate students or anybody from the public join?
Yeah, the trainings are they're designed for clinicians, but we don't close the doors to people who are not clinicians who feel that they would benefit from it and think that they should be there. They've got something to learn. We do expect everyone to participate, so it's not just a come and observe sort of situation. And we do role plays and experiential learning and all of that. But we've had people from a really wide variety of backgrounds. We've had writers, historians, attorneys, material scientists, anthropologists, definitely students. So if you want to come and you think you're up for it, you're welcome to. But it is geared for clinicians, so the languaging and things like that are definitely along those lines. Yeah.
And just to add, we do have a scholarship. It's limited, but we recognize that for people who are in need of support in order to be able to attend, we have that option.
Awesome.
There's an application. We are asking about people's motivations and how they're going to use that knowledge for the betterment of their community. So that's something that that's part of the process. Yeah.
Awesome. Well, thanks so much for your time, guys. It's been awesome and really cool to hear what you guys are up to.
You're welcome.
Thank you.
All right. Thank you for listening to that episode with Dr. Elizabeth Nielson and Dr. Ingmar Gorman from Fluence. I hope you enjoyed it and hope you got something out of it. It was really awesome to meet them in person and go over to their the clinic and actually where the MDMA therapy is happening over in New York. So really cool to check that space out and just to do interviews in person. It's so different, pick up on different body languages and stuff like that. So hopefully I'll be able to do more of in-person interviews in the future. So stay tuned for that. It'll be fun. And pretty sure probably have Dr. Gorman back on. We were chatting at the end of the interview that we would love to sit down and just riff for about 2 hours plus, just to kind of get into all the little nuances and complexities. So who knows, maybe that will be in store for the future. But yeah, I hope you enjoyed that episode. And again, if you want to check out their website, that is fluence8.com. Check them out. Check out their trainings and what they're up to. They're doing some really great work over there. If you have any questions or comments or anything like that, you can feel free to email us. Our email is psychedelicstodayemail@gmail.com. If you don't hear from us, maybe ping us again. Sometimes the emails get directed into weird folders, like our promotion folder or spam folder. I do make a habit of checking those. But, sometimes they do get lost, the way Gmail separates things. So, yeah, any questions, comments, anything like that, feel free to email us. And, yeah, again, be sure to subscribe to us, leave a review if you're feeling called to. And we really appreciate all the support that we've been getting over the past few years. We can't do this project without you, and it keeps us going. For real. So much love to everybody that's been supporting Psychedelics Today over the past few years. Joe and I are about to come up on 4 years here at Psychedelics Today come in May. I think one of our first episodes was around May 16th maybe. So yeah, I can't believe it. 4 years already with this project and things have been growing so many different directions. It's been awesome. And yeah, much love to everybody that's been supporting this project over the years. It's been really awesome. So yeah, thank you. So I'll leave it at that and we'll catch you on the next episode of Psychedelics Today. Have a great week, everybody.